what dyslexia is, according to the IDA, International Dyslexia Association, is that it is a phonologically based reading disorder that impairs a child's ability to read and spell effectively despite average intelligence or better.
Right.
See, well, that's exactly the same definition of a learning disability or reading disability. Make sense? So it doesn't matter what you call it.
Yeah.
So the next important question is, okay, what are we going to do about it? Well, don't they need some, eye training or something to stop the reversals? The answer is no. What they need to be taught is exactly what we do here. They need to get the phonemic base first. They need to get the mapping process going between letters and sounds. Do they need some work with B's and D's? Yeah, sure. Do we reinforce that? We have little tricks in our book that help to help child straighten that out? Yes. But one of the important ways is to get them to spell.
Yes.
See, with the paper and pencil, now you can show them, okay, the D is different than a P, and you can tell them how the straight line is drawn and the circle goes this way, straight line is drawn, circle goes this way for P. You can do the old bed technique, which lots of teachers use for sure, and it's good. It's a good, handy way for the child to distinguish it. But you want to do that until they have that in their own head, right? Until they have the what's called orthographic memory for the orientation of the letter. And the sequence of letters. That's what turns out to be vitally important, is the sequence of letters that you recognize within a particular word. So the label is not important. What is important is how you teach, how you treat that child. You have to treat the child with dignity. You have to come from their level. You have to understand that they are frustrated or they don't want to pay attention. But you need to understand that that's because they can't do the task. See, so once we start teaching them how to do the task, that's when we start seeing all these wonderful changes in their confidence and their behavior and their attitude towards working and so on.